What is a knee dislocation? Not a patellar or kneecap dislocation, but a true knee dislocation or a multi-ligament knee injury. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. A knee dislocation or multi-ligament knee dislocation is a devastating injury. It's one that involves multiple ligaments around the knee. We see it sometimes in sports. Marcus Lattimore, when he was at the University of South Carolina, is a good example, but there have been some others, Willis McGahee, I think, but they also not infrequently occur in motor vehicle accidents like car accidents. Basically, what it involves is tearing many of the ligaments around the knee. You have your ACL and PCL in the center of your knee. You've got the MCL along the inside of your knee, the LCL and some other ligaments on the outside of your knee. And you typically tear 3 or 4 of those. Your knee is grossly unstable. On one hand, you're probably going to need surgery because those aren't all going to heal on their own. And that can be a very, very big surgery, 4, 5, 6 hour surgery sometimes. But they're also important because when you do that with that much force, it's not uncommon to have injuries to the nerves or blood vessels in the back of your knee. And so I think that something like that, if it happens, is worth getting checked out right away. Go into an emergency room and seeing what that actual injury is, and there are some tests to kind of figure that out. Now, like I said, that usually requires surgery. Sometimes that's one big surgery or maybe two smaller surgeries. Really depends on a lot of factors related to what you injured, but that can be a big deal. Obviously, if there's no blood vessel or nerve damage, the outcomes are probably going to be better. But even if there's no blood vessel damage, no nerve damage, and you have surgery, return to sports is really difficult. You can get back to active things, maybe jogging, lifting weights, and maybe you get back to high-level sports, but it is very difficult and there's certainly no guarantee. So I think that that's one of the reasons among many that it's a very, very difficult injury. All right, have you suffered a knee dislocation? Not a patellar or kneecap dislocation, but a true multi-ligament knee injury. How did you do it? And what did you injure? What structures did you injure? And how did your surgeon treat it? I'd love to hear your experience. So in the comments below this video, tell us about it so I can learn from you and everybody else can learn from your experience. I can't answer specific medical questions in those comments, so maybe I'll answer them in an upcoming Ask Dr. Geyer question, but feel free to share your experience. Now, I would like to help you as you deal with a knee injury. So there's a link in the description right below this video. At the very top of the description, if you click on it, it'll take you to a page where if you answer a few questions, I can give you the #1 next thing that you need to do to understand and overcome your knee injury. It's very helpful, so click on that link and answer those questions. It takes you 30 seconds, 45 seconds, something like that, but I think it can be really helpful. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. I record several of these videos every single week, so click the subscribe button in the upper right corner of the page. They'll get delivered directly to you. Thank you so much for watching. I hope this video on multi-ligament knee injuries was helpful, and I look forward to seeing you right here next time.